Hey everyone, I'm Dr. Shannon Dowler. I'm a board member at the AAFP and a family physician who lives rural and serves many surrounding rural communities in Western North Carolina. Today, I'm joined by Jeff Winton, founder and chairman of Rural Minds. Jeff, thank you so much for being here with us.
Thank you very much for this opportunity. I'm looking forward to our conversation.
So we're here to discuss rural mental health care and how family physicians on the front lines helping patients in small towns and rural communities around the country get the support they need. May is Mental Health Awareness Month, and the need for care has never been higher. That is certainly true where I sit, where the impacts from Hurricane Helene continue to burden families in ways that we just could not have imagined 2 years ago. Jeff, I watched your video on your website. Wow, it was powerful. Can you share with our audience why you started Rural Minds and what your mission is?
Yes, certainly. Well, thank you for your nice comments about the video. Rural Minds is a relatively young and new organization. We were founded 4.5 years ago as a result of a family tragedy that took place in my rural farming family. I'm from a long line of dairy farmers, and our farm in upstate New York and Lake Erie is where many generations of our family have lived and worked. And my 28-year-old nephew, Brooks, who at the time worked on the family farm and was a father of 3-year-old twins, was suffering in silence. And unfortunately, no one in the family knew until after he had taken his life. And it became a real wake-up call for not only my family, but for the community, in that we had this silent killer that was lurking in rural America that no one was really talking about because of the shame and the stigma that exists with mental health. And as a result, my mother, who was alive at the time, who was a true matriarch of the family, said, we need to do something about this. This is going to stop with my family, and we're going to start talking openly about it. And that's what we did 4.5 years ago, and hence the establishment of Rural Minds.
Let's talk a little bit more about stigma. Why do you think there is so much stigma around mental health in rural communities? And how can someone in these communities help to shift those narratives?
Well, storytelling is critically powerful in tackling any type of stigma. And I shared my story with you about what happened when my nephew died. And we had people in our community and even in our family that weren't comfortable with us talking about the fact that he died by suicide. And again, it was due to the courage and the love my mother had for her grandson that said, we are going to start talking about this. It's the only way we're going to turn the corner. I'm old enough to remember when people whispered about cancer. We called it the big C. No one would talk publicly about cancer. Fortunately, due to the good work of many advocacy organizations, both on the patient side and the provider side, we've turned that corner. But we now need to get there with mental illness and treat it as an illness and not as something that people should be embarrassed about, because we will now openly talk about cancer. And if we're suffering from breast cancer, prostate cancer, we will go and seek help. And we need to do the same thing if we're suffering with depression or any other form of mental illness, because we can't just wish it away or pray it away. We have to go for medical intervention.
Yeah, absolutely. In my corner of Appalachia, substance use is a real challenge. And whether the substance use happened because of mental health challenges or as a result of substance use, mental health challenges emerged, it can happen in either direction. Taking away that judgment when people seek care is so critical. And if folks walk into our offices and they feel judged, they will walk away and not come back. We will have lost them. And that starts at the beginning, from the time they call to schedule their appointment all the way through until they check out and walk out of that office door. And so I think as healthcare providers, sometimes we need to provide a little more grace and a little more tolerance, and making sure that our entire office environment is accepting and welcoming no matter what somebody's coming in for. And we also know that people who are struggling with anxiety or depression are more likely to miss appointments, to not follow up, to have trouble sticking to the regimen. And so rather than feeling judged by that, we need to help them feel encouraged and welcomed, and that it's okay if you don't get it right the first time. We're here for you and we'll keep supporting you.
Yeah, absolutely. But what gives me hope as I travel around the country is that young people are talking much more openly about this. And in rural America, one of the most shocking statistics I've seen recently that was released by the CDC is that young people aged 15 to 19 who live in rural America are 74% more likely to die by suicide than their urban and suburban counterparts. 74% more likely to die. And so young people realize that their generation is feeling this disproportionately. And fortunately, a lot of young people are willing to talk about a lot of things that my generation would never talk about. So that's what's giving me hope. We have a new program we're rolling out later this year that's basically a peer to peer program that Rural Minds and some of our supporters have put together to help young people in the community in rural small towns to be the eyes and ears of the community. And if they see someone hurting, to make sure they know to say something and to speak up and offer to get their friends or whomever that might be the help that they might need.
So that brings me to a really important question, and that is, what would you say to someone who feels like they are having to carry their struggles alone, and is unsure about seeking out help for their mental health?
Yeah. Well, what I like to advocate for is just finding one person. That's all it takes. One person in your circle, whether it's in your family, your school, your community, someone we all have, I hope we all have one person who we confide in and who we can go to. And that one person will inevitably help you find the help that you need. But you need to be comfortable at least signaling that you need help. Now, knowing the independence of people in rural America, on our website, which is ruralminds.org, we have a lot of materials that are pretty much do it yourself type approaches because we know that some people either won't go and talk to anyone or may not have the time to do that. So we've got many resources that we've aggregated that will at least help provide some support that someone might need. And then, of course, you know, the 988 number. I can't say enough good things about the 988 helpline that was rolled out 4.5 years ago now, I guess. And that's a 24-hour a day, 7-day a week crisis line where you will be connected with someone who is a trained mental health provider. And they will stay on the phone or on the chat with you for hours if needed. And also will then help you find the ongoing support that you need after the particular crisis has passed. But that is, in many cases, as you know, doctor, the only mental health care that some people in very small towns and very isolated areas have. And there was an article that just came out recently that talked about how many lives have been saved since that 988 number had been rolled out by our government.
Yeah, I was working at the state when we rolled it out in North Carolina, and we were so excited about it. I think there's one other challenge that happens in rural communities that I didn't appreciate quite as much until I was deeply embedded in one, and that is that sort of the concern around lack of privacy. And so you might have one doctor in your town if you're lucky, but you might have family or friends or neighbors that work in that doctor's office, and so people will be worried that their information might be shared. And so I think it's really important for people to know that their family doctor will never share their health information or concerns with anyone. That we're here to support folks and to keep them safe, both mentally and physically, and that their privacy is paramount, is sort of our number one thing that we have to do. But even if someone still felt concerned with privacy and they still didn't feel confident in it, they can always ask for a referral somewhere, maybe just a little further away, and then do their cure virtually if they need to. But there's always a backup option for folks that live rural that really want to have a safe place where they feel like they can be themselves and open up to us. And I think that is one of the most important things we can ask people to do, and that is to be honest. Don't try to shield us. People want to shield their doctor from their real problems, like they don't want to burden us, but that's what we're here for. We're here to absorb it and take it in and help you find solutions. And it's so much harder for us to help people when they don't tell us the whole truth about what's going on. It just doesn't benefit anybody. And so we want you to burden us. That's what we're there for. And so don't try to shield your doctor from the truth of what's happening in your mind or in your life, because we're here for that.
I was very encouraged during my most recent annual primary care physician annual that they asked questions at the very beginning of the exam about how I was feeling and if I had thought about harming myself and things of that nature. And I was so thankful that they started the exam with that aspect as opposed to my blood pressure and my heartbeat and all the other things that subsequently they check. So you're absolutely right. Getting back to the whole confidential thing, a farmer in Montana told me that even if there was a mental health provider in his community, everyone knew what kind of pickup truck he drove. And so he said, if my truck is parked outside that mental health clinic, all of a sudden, all my neighbors are going to know that either I'm having some issues or someone in my family are having issues. And he said, so that gave me pause. But to your point, he said, so I decided to go a few towns over where nobody knows what I drive. And he said, then I had no concern.
That's so true. And there's not something else called collaborative care where primary care embeds behavioral health in the medical home. So people, if they see your truck in the parking lot, as far as they know, you're getting your blood pressure checked. They don't know that you're seeing a behavioral health provider at the same time. All these tools and tricks that I think people sometimes forget about, especially when you're in a really rural area where everybody knows your vehicle. And so to drive really carefully because someone's going to call you out if you drive too fast, or it does impact your ability to be private. Jeff, thank you so much for joining and sharing your story and this amazing work you're doing with Rural Minds. I want to talk a little bit about resources. We have fantastic, dependable, free resources at familydoctor.org that we would push you to. And Jeff, you said also on your website, you want to plug some important resources as well.
Yeah, so our website you can access by going to ruralminds.org. And we're in the process of actually, even only 4.5 years into this, updating it because we've grown so quickly and we've put so many resources on there. At times, I can't even find stuff. So the team is working on redoing that. But the good news is there's a plethora of resources on there. We just launched a new program specifically geared towards farmers that's actually on the homepage. That is, again, kind of a do-it-yourself approach to at least get people thinking about this before they launch into it. We're also doing a lot of work in collaboration with other organizations that have been working in the mental health space much longer than we have. And, it's going to take all of us working collaboratively to turn this corner because every 11 minutes, someone in the United States dies by suicide. So by the time we've finished with this conversation, Doctor, literally 3 people somewhere in this country have taken their lives. And that is tragic. And that's something that will, again, take all of us partnering together with to address.
Absolutely. Jeff, thank you so much for taking the time to be vulnerable and share your story, but also to bring up what is often a taboo topic for us to really speak openly and frankly about it. I really appreciate you spending time with us today and hope you have a terrific day.
Thank you very much, Dr. Dowler. I enjoyed it very much.